Hi everyone,
Hi guys.
good morning if you're in London. Actually, no, it's just turned afternoon now.
Yes,
Yep,
yes.
12. And it's Saturday morning slash afternoon. We're in London at the moment. We haven't done an AMA for about, was it 3 weeks now?
Yeah, yeah,
Yeah.
yeah.
So we thought we'll do something, have a catch up with you guys, answer any burning questions like what's happening to the crypto market. Nothing to do with us.
Yeah. We've actually stayed pretty steady.
Have
If you
we?
if you look at the med token to Ethereum ratio,
Yeah, I
we've been
suppose.
pretty okay.
Yeah.
I think that's the thing to remember is as obviously a lot of interest in our Telegram group and other communities we talk to ask a lot about the med token price, and I think we do everything that we can. We continue to publish material, continue to do these AMAs. We had a very nice newsletter which was just released, and this is going to be a monthly feature as well going forwards. We're actually all here in the London office on a Saturday in the UK, which is normally a weekend or a day we don't work on, but the team are very committed. We've all come in today to essentially take stock of where we're up to in all of our projects, and it's been a great meeting. Obviously, a lot of the stuff said is quite confidential, so we couldn't record it and post it here. But maybe there's a few things we can summarize from that meeting and share with the community. And of course, this is your opportunity. It's an AMA, so please feel free to ask us any questions on YouTube, on Telegram, and we'll try to answer them as best as we can.
Let's just do a test to make sure people can hear us.
Let's just do a test to make sure you can hear
Yep, they can hear us. That's fine. So if you have any questions, you can ask us on YouTube. You can ask us on Telegram, and we'll try to monitor and get to your questions as soon as possible.
So we've got a first question from a regular
Yeah.
attendee of the AMAs, as well as quite a big contributor to our Telegram group.
Following us around to the physical events as well. So
Yeah, exactly. And that's what we like. That's what we want more people like Amen. And I'm of course referring to Amen himself. So his question reads, how many patients have registered on the platform from the practice in South London?
Yeah, I think it's been several thousand now so far. We haven't got an exact figure, but it has been several thousand patients so far. Remember, we haven't just put these questions out to the actual practice. We've put it out to globally to get interest from patients around the world. So it's the numbers are pretty steady and within the expectations that we had.
Yeah, and likewise, that's got to be said from the doctor or from the healthcare professional side as well. If you see on our newsletter, there's a button there to click if you want to register as a patient, your interest, and to register your interest as a healthcare professional. And those numbers are climbing quite rapidly as well. So we keep trying to encourage people to come on board. So we have a list of contact details, and as we can start to roll out the platform to more pilots or practices other than the Groves in southwest London, then we can engage with those doctors or those patients who have shown a great interest. So as you can imagine, as Mo says, we had thousands of patients. We will look at the locality of those thousands of patients, which area of which country are they in, and say, look, there's a high interest here, that's where we should probably go next. So it's actually a good statistic, a good way for us to collate that information as well.
Yeah. Can we do a quick shout out to Luca?
Luca.
Yeah.
Luca, is he online? Is he with us?
Yeah.
That's it. Well done, Luca. We miss you. We miss you a lot.
Yeah. Luca's helped us out quite a lot with our social media. Another question, quick one. How does the token price affect you guys with regards to functioning as a company, if at all?
I think, to be honest with you, because, I mean, of course it's affected us like it's affected every other company in this space that collected funds for cryptocurrency. I think the benefit is because we have been so strategic and we've been very wise in the way that we've been allocating funds, it's not affected any of our plans. So we've not had to scrap anything, we've not had to slow anything down, we've not had to slow down any recruiting. So for example, today we had 17 people in the room in the meeting today, and we continue to hire more staff onto the Medicalchain team to build and take the vision forward. I think what we hope will happen is one of two things. Either the cryptocurrency will recover, which I think, personally, I do think it is. I'm not panicked about this at all. And I think you just have to take a longer period. We got spoiled in that period where Bitcoin was just going off the charts. And maybe this is going to take months or even a year and a half to recover. Or the second way that we are going to function fine as a team is we are going to start generating income as a company, and that's going to start bankrolling all the other plans that we have to do as well and give us more runway. So yes, of course, it's affected us like anybody else, but no, in terms of our plans, it's not affected us at all, and runway for the next year or two is very healthy at this moment in time.
I have to say as well, we haven't sold any of our own companies tokens or our personal tokens. So from this side, if we were relying on selling that to generate funds for the company, then it would have affected us. But we still have funds from our ICO and the pre-sale that we did. We diversified those funds quite early on because we kind of predicted that there was going to be a market crash or some serious volatility. So we did cash out quite a lot of our funds early on when the market was quite high, and we're not in any kind of serious detriment in any way. So we're pretty good. We're on track with our development. Question here is, what do you think about your competitors like Medicalchain, who's doing their ICO at the moment?
From my perspective, no comment. I'm still a doctor working in the UK, so I'm not going to jeopardize my medical license by saying anything. I'll leave this question for you.
Okay, so basically, we're a little bit disappointed that a company can go out there and get a name which is very, very, very similar to our name, and try and do an ICO. We've actually seen strong evidence that they have confused people deliberately to manipulate them into thinking that they are Medicalchain or that we're part of the same company, and we have documented evidence about that. We've also seen articles and claims that they have made which are completely ridiculous about who they have partnered with or their partnerships. And really, for anyone out there that's looking to participate in such a company, I would just exercise a lot of due diligence. And yeah, I like your smile. Wasn't really my question.
Can you see the sweat as well?
No sweat. I mean, they're trying hard to raise funds, and at the same time, they have confused a lot of people with their name, and that's very disappointing. Yeah. We've always said that we don't mind other ICOs working in our space, and we will support health related ICOs, but really there's quite sort of like a border that if you cross, there's a line that if you cross, then we don't really want to help you or see you trying to manipulate people. And I think there's been a lot of fishy and scammy stories coming out about Medicalchain that I would tell anyone who's looking to participate in their ICO to exercise a lot of caution and a lot of diligence. I won't go into details for legal reasons, but just be very, very careful about that company.
Yeah, I think in essence that you can do whatever you want to do. You can name yourself whatever you want to name yourself. There's lots of ideas that we came up with in the early days, and we realized actually we might be confusing people. Actually, we might be encroaching on somebody else's territory here, and it's just not the professional thing to do. And I think that's the disappointing thing is, if it's an innocent mistake or overlooked, I'd be quite surprised, because without trying to sound too arrogant, I think we are the biggest medical blockchain company worldwide. We're the most renowned, we're the most well known, we're the most invited to different conferences worldwide. We don't just focus on one country or had success in one country. We've been listed on several exchanges. We have more exchanges to announce hopefully in the near future. And when that misunderstanding happens, you don't capitalize on it. And I think that's where the grievance from our end is, that actually there appears to be a tactic there that was to benefit from the confusion out during our ICO days, to get people to join them under the confusion that they were actually Medicalchain, and they've failed to correct people a lot of the time when that occurred.
And to be honest, it's not just them. There have been other companies as well that have written that they've partnered with Medicalchain, and all of a sudden that's supposed to give them some credibility. And we've had to send out quite a few cease and desist letters to get such partnerships or stated partnerships removed from their websites. Right. So there's another. I don't know if this is a question or a statement. Hi, Medicalchain. Good luck with your venture. At the Master Investor Show, Jim Mellon launched Juvenescence.
Juvenescence, yeah.
Investing in the age of longevity. There may be future Medicalchain applications. Okay, cool. I need to.
Yeah, so I mean, the medical field is absolutely humongous. I mean, the point the person is making, I'm not sure of your gender, so I won't say gentleman or lady, essentially is what can you get involved in terms of healthcare? Can you talk about emergency healthcare? Can you talk about chronic diseases healthcare? Can you talk about just health and fitness, so improving yourself even though you have no medical conditions? And then you can start actually encroaching on the aesthetic side of medicine as well. So even I've dabbled in a bit of Botox and fillers as well.
Have you?
I have, yeah. There was quite a few happy customers. I like to say I've got quite a nice portfolio, but I've become too busy for that essentially. But medicine is wide ranging, and I think as we go forward,
will you accept tokens for Botox?
If I went back to it, sure.
Okay.
But I think that going forward, we have to really solidify our space and say this is our area in the sand, and then we can start moving off and by all means talking about aesthetic medicine as well, or rejuvenating kind of techniques. But that's something I think far into the future, and something we'd come across later on.
What is the next step in Medicalchain wider adoption in the UK market at first, then international? Look, we are working really hard on some really major partnerships in the UK and international. I think everyone knows by now that we're doing the NHS integration with GPs in the UK. So we're hoping that by the end of this year, or even by Q3 of this year, we should have a good integration with the GP systems in the UK, that we'll be able to pull any health record from any GP, or at least 98% of GPs within the UK. We're not really sort of talking a lot about that because we're still in the integration and the build side, and we like to actually show it to you guys and demonstrate it once it's ready. But we're having some excellent work being done and showcased right now internally that we will show you guys once it's ready and finalized. And then in terms of international adoption.
Yeah, you've not been in the UK a lot recently.
No, I've spent a lot of time right now in Asia in terms of discussions in Japan, Korea, and China. There's a strong demand for telemedicine from those countries to see European and American doctors. There's already a huge medical tourism market, and we're trying to capitalize on that. We're trying to enable the use of telemedicine applications on an international basis. And putting in cryptocurrency into the mix, so the use of our tokens effectively, and the use of our Medicalchain health passport. So there's a big strategic piece that we're working on to tie up all of these entities together and bringing in effectively Asians and where most medical tourism comes from for Europe and North America, and trying to bring it together on Medicalchain. And I think that's going to be a very interesting and exciting piece of work for us. Again, there's so many conversations and partnership agreements that we're working on right now. It's really not, as much as I'd love to give you more detail, it's really not suitable for us to do that right now. But please bear with us, and we'll give you some really interesting updates very soon.
And I think if you have a look at the Medicalchain events website, you'll see all of these presentations that Mo will be doing in the Far East, or the ones that we will be doing together in Dubai in the Middle East. And we also have a presentation that we've been invited to in New York in October as well. So we continue to be an international company, going to these events, attending, presenting, being keynote speakers there, and as well as trying to establish relationships with the decision makers there to really drive Medicalchain into all healthcare systems worldwide.
And there's a lot of government conversations in there as well. There's a question here. You're going to take a profit from telemedicine as a percentage of service. Are you planning to distribute some of those profits to shareholders, proportional to stake we have? So it's important to identify here that token holders are not shareholders in Medicalchain. You're holding a utility token, so there is no distribution of profit on those tokens. we would love to do that, to be honest. We would love to have some kind of distribution or profit sharing on these tokens, but at the moment, securities laws don't allow us to do that. And if we did do that, the tokens wouldn't be tradable on an exchange, because exchanges don't trade security tokens, or at least the major ones don't allow it anyway. So at the moment, 100% we cannot do that. The token is a pure utility token. It's functioning as a payment for the services that are going to be offered on the platform. But who knows? In the future, if laws change and there is a wider adoption of securities tokens, who knows? It would be nice to explore other uses of the token that would make it a security, but there has to be 100% regulatory acceptance, not just in Switzerland where we are headquartered, but also in the jurisdictions of the exchanges that are exchanging our tokens, because they've also got to be regulator friendly when it comes to securities.
Yeah, I mean, in summary, we're not against the idea at all. That's mentioned. That's not our current position. That's not our current format that we're in. And obviously, if anything were to change, then we would advertise it to the community, but nothing is going to change in the near future. We have a question here saying, how long will the current pilots be running? Would you say they're a success so far? So we can address those questions, then move on to, has there been any feedback from either the doctors or the patients that have been involved? And if so, are there any lessons learned or things you plan to change?
So the pilot is actually going live in July, the first pilot with the Groves. What's happening right now is we're taking registrations. So we're taking registrations from patients and from healthcare professionals for the pilot. So we can't say that it's gone live just yet. We're only taking registrations. In terms of feedback that we've had, it's only been from doctors that have seen and played with our application internally, and there's been a lot of feedback, and some of it has been positive, some of it has been, you need to go back and change this, you need to add so and so features that we didn't add before. So we have a big development roadmap that we're working on at the moment, and working quite frantically on it as well to try and get the app ready. So the telemedicine app needs to be ready in Q3 of this year. The health passport needs to be ready before that.
I mean, if you're asking about how discharge summary has gone, it's gone very well. It's been very successful. That's been running now for nearly a year in various hospitals, and it's continuing to be onboarded by other hospitals as well going forward. Essentially, we have a system now where the hospital specialists are requesting specific templates for their department, and we are able to turn those around in a very short space of time, in less than 24 hours. So if there are any clinicians listening to this AMA, this YouTube channel that we're doing now, then by all means reach out to us, contact@medicalchain.com, or you can visit dischargesummary.co.uk directly and find the contact button there. And we're happy to assist with that. That is a completely free service, one that we're happy to provide because it really supports doctors and patients and really the healthcare system going forwards, and we're happy to continue supporting that with no charge at all.
Cool. There's a question there. Your thoughts on US-based Medchain company, Medchain.us. Sorry, I have to say I've never heard of these guys.
No thoughts. Sorry.
I have to look into it.
Yeah, maybe we'll look into it later on, but they've not come on our radar at all. Just the only US one is Patientory, which has come onto our radar. Who were around before we started, and there's nothing really going on there either.
Health records of a Dutch celebrity were viewed by hospital personnel that were not involved in treatment of the celebrity but had access to the hospital system. Could Medicalchain prevent that?
Yes, of course. So this is actually, if you've seen one of our presentations or managed to come to one of our live presentations, we talk about Richard Hammond, who's a celebrity in the UK who used to do a show called Top Gear. He now does one called Grand Tour, the Grand Tour on Amazon Prime. And essentially, he is a very famous celebrity in the UK and internationally as well, actually. He got involved in a car accident, one of many he's been involved in, and he essentially turned up to a hospital in the north of England called Leeds, and doctors and nurses were accessing his medical records because they were trying to find out what's happened to Richard Hammond. And by no means was it done in a malicious way. It's just, you know, nosiness, out of interest. They want to know what's happened to this celebrity, and of course it's entirely a breach of confidentiality and data privacy there. And the way that the Medicalchain system works is the user, being the patient, grants access to the doctors that will be working with their records. So the other people in that hospital that have a login for the particular hospital system can't see that patient's records without the patient's explicit consent for them to be connected to their records. And likewise, once their consultation is finished, or once the treatment has finished, or they've left the hospital environment, they can revoke access to those doctors. So the only people viewing the records are the only people that should be viewing the records. So yes, it happens all the time, and Medicalchain could prevent that, to give you a straight answer.
Yeah, and just to answer Camille, we did see the video actually. I only came across it yesterday. One of my colleagues was showing it to me, but it's in Dutch. I don't know what they were saying about us, and I asked for someone to translate it for me. So I'm waiting to hear what they were saying about.
Which Dutch is this?
The Dutch TV news segment.
National TV.
I don't know. It was a TV news segment which featured Medicalchain, or they showed parts of a Medicalchain video.
Any Dutch people out there, get back to us, please.
Can you tell us what they were saying? Because
and who are they? Are they a national channel? Who are these people? Because obviously we're happy to publicise ourselves, and if they wanted to talk to ourselves directly, we'd be happy to do something with that network as well.
Yeah. There's been quite a bit of media coverage as well recently. There was some media coverage yesterday about us and NASDAQ.
Yes, that was very pleasant to see. I think we've said many times in these videos, we don't pay for advertising. We try to generate everything organically in-house just by doing the good work. So that's great to hear. NASDAQ wrote about the second time now. Third time now they've written about as well, yeah.
Yeah. You often mention that... you often mention this is not a market where winner takes it all. Doesn't mean that Medicalchain could partner with other med platform, cosmetic surgery as an example, to offer an even wider range of products and services.
Yes, you know, by all means. I don't see why that couldn't happen. I mean, I'm engaged in these conversations every day. You know, Mo likewise, and other members of our team. We get added by tens of hundreds of people every week on LinkedIn, for example, with questions saying, do you think there's a potential collaboration here? Could we work together? I'm from so-and-so background. I represent so-and-so company. And to all of them, in time, yes. But right now, limited resources, limited focus has to be on the projects we've set ourselves in the time frame we've set ourselves. You know, one of the things we pride ourselves is on under promising and over delivering. And I think if we start making all of our plans too thin and broad based, we won't actually deliver on any of them. So let's focus on the ones that are achievable right now, and the ones we're working hard on right now that will give us positive results. By the end of this year, we'll have a lot to look back on and say, look at all the things we achieved in the year of 2018, and then we can work forwards on the ideas that you suggested. So definitely open to the idea, but I think until that time comes along, we have to focus on the roadmap that we're working to at the moment.
There's a question here. What about medical students? Are they going to have access to patients' records?
Currently, I don't see how they could. If they want to have access to any records, so even for example,
it's got to be supervised, right?
It's got to be supervised. So when I was a medical student, I couldn't just go onto a computer and log in. I have no login as a student onto a hospital system. Whenever you start practicing medicine in a new hospital, in a new department, you have to have an induction program. You have to go through information governance, data security, data handling. You have to have all your logins printed and given to you. So they don't do that with medical students, because medical students essentially come and go through the ward every week. You'll have a group of 4 medical students that come to, say, the respiratory department. After a week, they've cleared off, and the next batch of 4 students have come to learn a little bit about respiratory. So that's why students aren't given access in the first place. And if they were to see any information about a patient, it would again have to be with the patient's consent. And that already naturally happens. If any of you have ever, unfortunately needed a doctor and found a medical student in the consultation room with you, you'll find that the doctor always introduces that this is a medical student. This person is not vital to this consultation. Are you happy for them to remain in the room? And that principle goes forward with Medicalchain as well. We're not there to facilitate medical students getting access to anybody's records. There's no clinical need for it. They have a supervisor, they have doctors that are supervising them. And if there's any information for the students' learning needs, then that will be filtered down to them through that doctor's agenda, but not something we need to facilitate directly.
By the way, if you're in Korea, we are going to be speaking there next week. So I'm speaking at the CEO Summit on Thursday, the 12th of April, and then Friday, the 13th of April, we're doing a meetup for our Korean token holders and giving them an update on Medicalchain and the different initiatives that we're working on. So if you are around, please register and come along. It'd be great to meet with you and to talk to our Korean community. So we have some other questions as well from Reddit. This is a question for you, I think.
Okay. So it seems like you have to build an underlying system that processes each EHR into the Medicalchain paper, from what I can tell. You really just can't get around that, and it will take time. Granted. Unless there is something new that I haven't heard of yet that is standardized. Once you get to that stage, I'd love to see integrations with CDSS tools like VisualDX. So this question from Reddit is absolutely fair point. Essentially, the countries we're focusing on have major stakeholders in EHR, or electronic health records. So in the UK, that would be EMIS and TPP, or also known as System 1. And in the United States, for example, it's Epic and Cerner. So our objectives right now is to establish integration and pairing with those EHRs. So we've already done our information governance toolkit. We already are progressing very well with one of the major ones in the UK to have our pairing and integration with them directly. We are also doing a lot of work with a clinic in the US, which already has full permission pairing and integration with one of the large EHRs in America. I'm sorry I'm being quite cryptic here, but I want to make sure I don't say anything which should be public knowledge yet. But essentially there's two ways of establishing EHR integration, if you will, if I can answer the question that way. One is us doing it directly, which we are doing in the UK. And another way is if you're partnering with a well-established institution which already has those permissions, then by default we also gain those permissions as well, since we're partnering with them. So those are the two ways we're going about it. There are many, many hundreds of EHRs out there. I think the whole point of Medicalchain and the whole objective of Medicalchain is to empower the patients and to move away from these siloed individual data banks, if you will. And we just want one system where any patient or any doctor can log in and see the information which they have access and permission to see in an easy format to really facilitate those consultations. And that's what we're working towards.
Cool. A few other questions here. What are your personal predictions for the MTN coin value in December 2018? I don't think anyone can realistically give a prediction on any cryptocurrency right now. And especially MTN, because we're so involved, it would be completely inappropriate of us to comment or speculate on such a
Armand's checking his crystal ball. He'll get back to us. Armand, let us know what the crystal ball says. He might be able to
give you a better answer.
Yeah. So you might just get a picture of a moon going that way. Yeah.
Look, we've never ever given any comments about the price of MTN or where it's going to go, because it would be wholly inappropriate for us to do that. The SEC and all the regulators would be completely against us speculating on something like that. So I'm sorry, I can't give you an answer to that. Is the Medicalchain ecosystem aiming to become decentralized? I mean, the way the MTN tokens are managed. Well, the MTN tokens are already decentralized because they're running on an ERC20. They're ERC20 tokens. They're running on an Ethereum network. Medicalchain itself is becoming decentralized. We actually already have our test network running. We already have, I think, about 6 or 7 nodes deployed. It's not something we've been publicizing because it's still a test network, but it's already running and the token functionality works on it, and there's a lot of testing in-house that's happening. But most of the nodes are run by us, so we are now in the process of giving them away to organizations so we can make it decentralized. Okay. And finally, the question here about exchanges. Are you planning to be listed on other exchanges? So yes, we would like to be listed on other exchanges, but they've got to be good exchanges. There are about, by my count, around 200 crypto to crypto exchanges, and on most of them we can list very easily right now because we're already listed. We already have a lot of token holders. We already have liquidity. The question with exchanges is some exchanges want us to be listed on them because we bring more value than they bring to the token, and some exchanges, we want to be listed on them because they bring us more value than we bring to them, and it's kind of like a bartering discussion. There's a lot of new exchanges that are coming up and they want us to list on there for free, but we're being very, very careful and very selective because we have a duty to you guys, the community. If we just direct you and say, hey, there's this new exchange that looks quite good and we're listing Met tokens on there, and you go and you deposit Ethereum on it, or you deposit your tokens, and that exchange gets hacked, or it turns out the owners of it were a little bit unscrupulous, then we will have guided you to go to an exchange that was pretty dodgy. So I think we have enough exchanges that are running Met tokens right now, and there will be more soon. But this is why we have to be careful, especially in this kind of market environment, as to which exchanges do actually host Met tokens.
Yeah, I mean, it just serves no purpose to be listed on so many crypto to crypto exchanges. There's over 200 out there. Mo was telling me the other day, and we could just have a web page which shows 200 crypto exchanges that we're listed on. But how many of them will survive? How many of them are honest and truthful and transparent? And how many are going to actually add value to Medicalchain? And at the end of the day, that's the sole focus of our project, is the success of this company and the success of this project. And if there's no value added to the company, then there's no reason to do it. And we maintain that approach as well. Guys, it's now 12:30. I can see there's a few more questions coming through, but we're going to have to leave it there. Hopefully until next time, we'll do another AMA, probably Dubai?
Maybe, but the internet connection is not so great there.
Okay, we'll try our best. It'd be nice to take some to do the AMA in a nice sunshine environment, because we've not had any in the UK. But thank you again for joining us. For any of your friends that have missed this AMA session, please share the video with them as well. Keep the conversation going. Tim and the other community managers are out there to answer your questions on our behalf, and please continue to engage with us. Keep your suggestions coming in, and thank you very much for listening to us.
Yeah, thank you very much, guys. Bye-bye.
Bye-bye.
Bye.